Hey guys, it's Maggie and I am back today to talk about a subject that I'm very excited to talk about and I've been meaning to for quite some time now, and that is pelvic floor therapy and the exercises that I do to help improve my pelvic health, my enjoyment of intimacy, and the ability to use tampons. Before you click out of this video because you say, that's not relevant to me, I have no use for pelvic floor therapy, I do want you to know that it is used in all people and for many different conditions. I'm going to talk a little bit about the surgery that I've had, but this surgery in men can cause erectile dysfunction, and that's something that pelvic floor therapy can help with. It can also be used in patients that have chronic constipation, obviously used with postpartum and pregnant ladies, or somebody like me who no longer has a colon or a rectum. So just a brief background on my history. I have Crohn's disease, which is an autoimmune disorder of the GI tract, and unfortunately it mainly attacked my colon and rectum. So after dealing with this disease for a very long time, in 2019, I had my colon and rectum completely removed and my anus sewn shut. What I wasn't warned about, which I really wish they did, is that the rectum provides a lot of support to the vaginal wall. So once that support is gone, there can be some changes in there that are not super great. It caused a little bit of an outpouching of my vaginal wall. There's like a little pouch that my pelvic floor therapist could actually feel. And it also caused all of my pelvic floor muscles to be extremely tense. It's like they were trying to make up for the lack of support because my rectum wasn't there anymore to do the job. So that kind of made sense when it came to the pain I was experiencing during intimacy. And when I say intimacy, you know what I'm talking about. YouTube, I think, doesn't like the word that I want to use. But it caused a lot of pain. It caused pain with tampons, with period cups, with period discs. And that was really frustrating because I didn't want to walk around with a giant pad all the time. This was all very frustrating, and eventually my gynecologist said, hey, let's get you to a pelvic floor therapist. And I wish I had done it sooner. I wish I had gone a lot sooner than I did, but my hope with this video is that it encourages you to find your own pelvic floor therapist. I am going to show you some of the techniques, some of the things that we use to help calm things down in there. This is meant to encourage you to find your own so that way they can figure out what exercises will work the best for you. Because I am not a pelvic floor therapist and I am not trying to pretend to be one. That is a lot of schooling that I just really would not want to go through. Nursing was enough school for me. Before I show you some of those exercises though, I want to show you the other tool that we used that in combo with the exercises made a world of difference. My pelvic floor therapist recommended that I start using dilators to help kind of get me used to a touchdown there, because the way I'll describe it is that with all those tense muscles and the pain that I had repeatedly experienced with anything being there, it was kind of like my pelvic floor cringing at anything. So the dilators were meant to kind of calm things down in there, get used to something bang in there. And then she recommended a pelvic floor wand, which is better able to reach the side muscles in the pelvic floor. And those muscles in me wound up being extremely tight, like super toned, trying to make up for that lack of rectum support. Now, mind you, as an IBD patient that has experienced a lot of issues with their intestines and a lot of issues with their rectum, I used to have to do rectal dilators, and that was probably one of the most traumatic, more traumatic than feeding tubes. It was hard on me. It was very painful, and I remember the dilators being metal and cold and really hard. Obviously, it's metal. And it was awful. So when my pelvic floor therapist said, hey, let's do dilators, I was like, I don't want to. I don't want that experience again. But she showed me ones from Intimate Rose, and I've talked about them before. These dilators are colorful, they're soft to the touch, they're flexible. And when she showed me them, I was like, okay, I feel better about this. I feel more comfortable moving forward using these. And Intimate Rose reached out to offer a partnership for me and my viewers so that you can receive $5 off of your purchase if you are in the market for dilators or pelvic wands or other pelvic floor tools. These guys have made a huge difference in me being able to identify the muscles in my pelvic floor and being able to work them out and calm those muscles from overreacting. So if you use coupon code LetsTalkIBD at checkout, or if you use the link in my description, you will get $5 off of your purchase. Thank you so much, Intimate Rose. I can't recommend them enough, and these tools, along with the pelvic floor exercises I'm going to show you, are what truly changed my life and my pelvic health. Now, when I show you these exercises, you're going to look at me and be like, Maggie, how in the world can something so simple make such a difference? Now, like when I was talking with the pelvic wand, when I would reach the side walls and work out those muscles, it was very sore when I first started. And as I continued to use them, it calmed down. It is very similar. The different muscle groups around my body that were also compensating for my ostomy surgery or my proctocolectomy surgery, I've been cut open a fair bit. Let's just put it that way. Those muscles were tight, and I had to work that out as well. A lot of what my body was doing was trying to compensate for my weak abdomen and my weak pelvic floor. And holy cow, when I started these exercises, they hurt. I mean, like, tears in my eyes hurt. But now they don't anymore. Now they feel good. They feel like I'm stretching them out. So it's a very similar feeling, and I'm just amazed that something so easy, painful, but easy help make such a difference. All right, so let me show you these exercises. Hello, you're seeing a new view of me. So the first thing that I'm going to show you is abdominal breathing. That was the first thing that my pelvic floor therapist taught me to do. And if you look at a newborn baby, you'll see that they have their belly rise and fall when they breathe, and that's because they're doing abdominal breathing or belly breathing. And I know that a pelvic floor therapist will explain this much more scientific than me, but when we breathe up into our lungs, which is how a lot of people breathe now, they try to keep their bellies flat, it puts a lot of stress on the pelvic floor, so it kind of gets like tensed up a bit. So when we do the belly breathing, it allows our pelvic floor to have a break. So essentially when we breathe, instead of having the air kind of go like that and our belly sucks in, you want your belly to actually expand as you breathe in. And when I breathe in and my belly expands, it gives my pelvic floor a break. Welcome to my living room floor. I've got the lens changed out for a wide angle, the microphone is changed out, so hopefully the sound isn't too different, and the hair has been put up because it's about to get serious. So let's get into a couple more exercises. I do have a couple things here that have helped me. The first being this roll. This is, I think, from Amazon and was maybe $15, and I stole it from Zach's cousin, so he's not getting that back. And the other thing is a rolled up towel. These are the only two things that I use when I do these exercises, so it is fairly cheap. There's no big equipment that you need. And like I said before, the left side of my body tends to be a lot tighter, at least like below my belly, because it's just trying to give my right side a break. It said, right side, you did a lot of work getting all that surgery done. You can see that's where my stoma is, right there. It said, you take a break. We'll handle things from here. So anyway, while that's great, like, thanks body for trying to fix things, yeah, it makes it a lot more painful. And the muscles in my leg particularly have caused some issues, especially during intimacy. So I'm going to work out a couple of those muscles. It helps me to be able to move a little bit better. So let me show you those now, and we'll be using this guy. Oh, and if you do have an ostomy or you've had abdominal surgery, please make sure to check with your surgeon that the exercises your pelvic floor therapists give you are safe for you. Don't want to pop a hernia, and there are hernia belts also to help you in case this is a concern. Alright, let's get started on this. So the first that I'm going to show you is me rolling out my quads. This was, I think, the second exercise my pelvic floor therapist showed me, and it truly has made a world of difference. But I was like, that's easy, until I did it, and it was super painful. But as you do it more, it gets less and less painful because you're working out that tense muscle. So essentially what I do is I work out one at a time. I'm going to roll the roller underneath one leg. So I'll start on my left side. Kind of make sure that my leg is centered on the roller. And put my arms down like this. My other leg is kind of up in the air. And I just army crawl back and forth. Oh. I do try to keep my back straight too. And that's all I do. It's crazy, I know. And then I switch sides. The next one was even more painful. I'm hoping that I can show this, but like it was a little awkward to learn. But once I got the hang of it, it was fine. So I'm going to be rolling out this muscle in here. It's an adductor. Actually, I think it's a group of adductor muscles. I have so much dog fur on me. Anyway, I'm going to be working out the adductors in here. These were even more sore, especially as you get closer and closer upward. Oh my gosh, it was so sore, especially like right there. So I'm going to take the roller. This is kind of weird. Put my one leg down, and you roll like that. Now, mind you, my form may not be perfect. A pelvic floor therapist will be able to correct your form if I'm doing it completely wrong. All I know is that when I do this, I can feel the muscle being worked out. And then I switch sides and do it to my right leg too. My right side is much less painful than my left, like I said before, but that's what I do. Something else my pelvic floor therapist noticed is that I slouch a lot, probably again because I'm trying to take the pressure off of my belly. If I lean forward, I'm not stretching out my scars or the area around my stoma too much. If you've had the surgery, you know that you try to sleep at like a 45-degree angle rather than flat because it hurts, but that has contributed me to kind of turning inward, which has probably not helped the back issues that I was having. If you saw my video a few weeks ago where I pulled a muscle in my back, probably not super helpful for that either. But one really simple thing that my pelvic floor therapist had me do was lay with this along my spine and put my arms outward. Am I even on camera? Oh, I am. Hello. So I lay like this for a little bit, and it opens up my shoulders. She also had me turn it like this and kind of move it upward on my back. Feels good. So that was another one, super simple. And when you're sitting in a chair too, another thing you can do is just place a rolled up towel behind you on your lower back so that way it forces you to sit up straighter. That was another tip she gave me. You can buy pillows like that, but this is cheap. Alright, and the last thing I'll show you for the shoulders and the arm to open them up, I like this one a lot. It feels good, but it hurts too. Fold your legs up a little bit, and I'm going to lay with my arm out like this. Put my hands together, and this is something called like the open book, or like bookends, I forget. I think it's open book because you're basically opening up and stretching your shoulders. I'm hitting the wall here. Normally you wouldn't have a wall. But as I do this, I can feel stretching all along this arm. And you hold it. Whew. You bring it back. And you just need to keep your hips, your legs facing that way. You don't want them to come with you. You just want your arms. Oh, yeah, that hurts. Hurts so good. And doing this 3 to 5 times a week has really just changed the way I carry myself, my comfort level, and most importantly, my pelvic floor. So those are some of the things that I have done to improve intimacy. Again, I'm going to use that word. Really change it, make it enjoyable as it should be and not painful, as well as being able to use things like tampons and period discs. And it makes me sad because I think people, it might be a taboo subject, I'm not sure, but they're embarrassed to get help for their pelvic floor and they think, well, this is just how it has to be, like this is how it's supposed to be. And it isn't. It isn't supposed to be that way. So I really hope that this video encourages you to seek out a pelvic floor therapist to hopefully make things like intimacy and using tampons more comfortable. Or if you have some other issue that could potentially be improved with pelvic floor therapy, that you move forward with it. I had a friend reach out to me recently saying that, mind you, not in the health community, not ostomy, not IBD related, just reach out to me and say that her gynecologist recommended a pelvic floor therapist for her, and that she was upset about that, but then she saw my videos talking about it and she felt better about it. And that's what I'm trying to do. Highly recommend that if you think you've got something a pelvic floor therapist could help with, to reach out to one, and hopefully they can get you feeling better. Alright guys, thank you so much for watching this video. I hope that you enjoyed it and hopefully learned something. I don't know, maybe not, but I hope you at least enjoyed it, and I will see you in the next. Bye guys.